today we have with us Mr. Suresh Kakani. He's additional commissioner, work with BMC, and he has been heading the health department since he took over. He's basically in charge of western suburbs and has the health department with him. Earlier he had also the fire brigade, and now he's also going to be in charge of the elections. So he's been planning right since the first phase of COVID. He's going to tell us about make a small opening remark on how he planned for the COVID first wave, second wave and third wave, and how they set up the jumbo units everywhere. And now probably the fourth wave, which they expect in June. So I request sir to make a small opening remark.
Yeah, thank you very much, all of you. I mean, almost a few of you, I mean, not all, but most of you are in touch with me on daily basis, frankly. Sometimes physical meeting are also happen, but interaction on telephone, that is a frequent thing, because whenever I retire from my office, while traveling to my home, I try to answer most of the calls, not all, but most of the calls, so that before reaching home, I try to finish most of the call and whatever queries, whatever questions.
That's why most of the responses we get around 8:39.
Yeah. So, and now I'm getting calls in the morning that I first want to call you. Now you should reply in the afternoon or in the evening. So that is what that is what I'm. But it is good to interact with you, because COVID. All of you are aware that COVID is such type of pandemic situation. It was never before. It was difficult to predict how many patients are there, how many facilities do we need, how many beds we may require, what would be the treatment protocol, whether the oxygen oxygen would be in demand, or whether the ventilators will serve the purpose. All these things, I mean, unforeseen, you can say, situation. But I mean, we learned very fast. I mean, during first wave, we had only one hospital having 28 beds, 3 to 4 ventilators, equal number of ICU beds, and initially we thought, I mean, it would be sufficient in the sense, because during first 15 days, hardly 1 or 2 patients used to come in the month of March. But the first day I recollect, in the month of April, on that day we got 150 patients, and that was an alarming bell for us. And then we had decided, now, I mean, the things are getting serious, and we should try to build our infrastructure or upgrade our infrastructure. Initially, we tried with the existing facilities, like we have 5 medical colleges, that includes one dental medical college. Then 16 peripheral hospitals, 5 specialized hospitals, 28 maternity homes, and close to 200, you can say, dispensaries, and equal number health posts. That way the infrastructure setup was good. And then we tried to pull in beds for COVID. Then we realized that we can't exceed 1,000 beds, even if we take few hospitals entirely and some beds from the hospitals. Then on one day, my entire team sat together and we tried to work out how many beds can we generate from the existing facilities, not more than 1,000. From that day onwards, we decided that we should try some other options. Initially, the railways decided to offer their bogies. But when we realized that it won't work, in the sense ferrying patients to that facility, number one, then providing some medical support, number two, shifting patients in case of emergency to the critical facilities, we abandoned that idea. One more idea was presented to us, that I mean, one ship was there, one cruise was there having 2,000 beds. So let us take it over and ship all our patients there, all our symptomatic patients there, or the asymptomatic patients there. But again, the logistic support was a challenge, and therefore we decided that we should not go with that. In case a patient is to be shifted to facility, or after few days the patient may get recovered. So there is no point in keeping that patient for 14 days at a stretch and unnecessarily occupy the precious infrastructure on that. Then we started thinking about developing some hospitals, some field hospitals, you can say makeshift hospitals of the jumbo facilities. That started from NSCI. NSCI dome we could requisition for housing the Worli Koliwada people, because that is a close by facility, and it was just a content center, just put beds and provide some housekeeping and the cafeteria support with medical support. Those were not symptomatic or those were not positive patients per se. And that really clicked, and that facility got converted into the isolation facility over the period. And again, some interventions that touch base or use of IT, that also happened. After that, we started developing, we were in dialogue with the government and other line departments as well. Our entire machinery was preoccupied with the COVID handling. So government decided that instead of focusing on the developing of jumbo center, let us give it to some other agencies like MMRDA, SIDCO, MHADA, and all like Mumbai Metro or MMRCL. And that was a starting point for developing two centers, one at NESCO, Goregaon, and one at BKC. BKC came up early because it was a makeshift arrangement. It was just, it was meant for the housing quarantine patients, not the positive patients. Quarantine patient to start with and the asymptomatic patients, where the medical intervention may be less. NESCO, it was in a bad shape in the sense, no housekeeping, no proper infrastructure. Then we had to transform that entire facility, entire exhibition center into the jumbo facility. These two facilities really, developed some confidence among all of us, and that was the turning point, you can say. Subsequently, during initial phases, most of you are maybe aware that patient used to chase us for getting bed, for getting treatment, for getting some their queries answered, and we had only one control room, central control room at the headquarters, and that used to handle. But again, we used to get call late in the night at 2 o'clock or 3 o'clock. Even I used to receive calls from various sources that we need bed, otherwise our patient will die. So therefore, we decided that we should decentralize our bed management system. In-house, we develop a small dashboard, having limited access only to a few of us, and of course with the war rooms. These war rooms concept really clicked, and therefore we could reach out to the patient. Instead of patients reaching out to us for getting bed, for getting treatment, we could reach out to the patient, and that really helped in confidence building. Because as you are aware that during third wave, 90% patients were asymptomatic. Only 4 to 5% patients are required to get admitted in the hospital. That was the case, but because of the fear factor, suppose I am positive, then my mental health or mental level reduced like anything, and I started losing hope in myself and in the system. Because of that, the entire machinery was under tremendous pressure. So the decentralized bed management system really worked very well. We also partnered with the private hospitals. Initially, we requested them, we motivated them, we appealed them. Subsequently, in the month of April and May, government came out with some regulatory orders saying that 80% bed should be offered to COVID beds. Should be offered to municipal or government authorities, and 20% bed they can use at their discretion. Number two, the rates, because the first notification came, as I weekly recollect, 30th of April, but the rates were not regulated. So we started getting complaint that we are being charged, overcharged, and that was again a cause of concern for us. Then on 21st of May, Government of Maharashtra came out with notification that yes, 3 categories are there: normal bed, oxygenated bed, and ICU beds. But how to implement this? We have issued various notifications, we have issued various directions, but how to implement it? So we realized that we have a auditor because during COVID pandemic situation they had no work because they were sitting idle and just, coming to office if they wish, or otherwise they used to spend time at home. So we posted them to the various hospitals. We requisitioned almost, not requisition per se, but we regulated almost 130 private hospitals. Then we posted at least one or somewhere two, if it is bigger hospital, two auditors in the hospital to regulate three things: whether the dashboard is updated on hourly basis or not, number one, whether the asymptomatic or on the 80% beds, are they admitting directly without consulting the war room or without consulting us, and number three, whether they are charging as per the notification issued by Government of Maharashtra. Initially, there were some complaints and we realized that yes, it is there. Then we didn't hesitate to lodge FIR against the respective hospitals. That really played a trick, and everyone came on board. They started following regulations, rules and regulations, because by that time, initially the slum dwellers or the people of densely populated area were more in number, but subsequently we started getting patients from the buildings and the high income group people, and they have more faith in the private system rather than the public system. So the demand for the private hospital was much more. Because of this intervention, we could provide bed. It may not be a choice bed, it might not be a choice bed, but it was the bed in the choice hospital, which someone might have been asked for the independent room or the room having good view. So that was again challenge, but we tried to convince them that your health is more important than anything else. If you are survived, then the sky is the limit for you. You can enjoy the way you like. People also cooperate. I won't say that people are not cooperating, we were not cooperating, but they also cooperate that yes, whatever is there, we should get and get ourselves treated properly. Then the second challenge came that our treatment protocol, it was not in place. Meanwhile, Government of Maharashtra constituted one task force to advise on various issues, including the treatment protocol. But what treatment protocol? SCQ, that is hydroxychloroquine, or it was today allowed, but tomorrow it was banned. Plasma therapy, we tried on that as well, but it was not well taken by the medical fraternity. Then remdesivir, tocilizumab, again during second wave, everyone was prescribing that go ahead, bring remdesivir, otherwise your patient won't be survived, or it will be difficult for us to treat him properly. So that was a mad rush for remdesivir and all these things. In the medical, in the public hospitals, including jumbo facilities, our treatment protocol, we standardized our treatment protocol after discussing internally, and we procured enough quantity of remdesivir, enough quantity of medicines for providing it to the needy patients. And as per the prescription of the doctor, as per the assessment of the medical practitioner, because someone non-medico used to advise them why are not giving remdesivir and why remdesivir is not being given. You are selective in providing remdesivir. But because we didn't get carried away with their opinion, we just relied on the medical prescription or the whatever prescribed by the treating doctors. Then the death rate was really challenged during the first wave itself, and that time it was necessary to rope in the expert doctors, the HODs, the professors. Unfortunately, all of them were having age more than 55. And as per the guidelines given to us by ICMR or by Government India, you should not involve the person having age more than 55 in any of the COVID activity. But at the ground, unless you involve them, you can't really leave your patient at the mercy of the junior doctors or at the mercy of the assistant professor. They may not be, though they are knowledgeable, but some support from outside or inside is badly required. I personally traveled down to all the hospitals just to interact with the senior doctors and patients, and I just explained that this is the death rate of your hospital. It is not advisable. Suppose after a few months, everyone would start questioning us why we could not control a death. After that, after interaction, we realized their difficulties, but we appealed them, and they also started coming on board. Three things we have asked them to do: prepare the list of critical patients, discuss the treatment protocol, because for that there is no need for you to go and visit the patient. But the third thing, visit the patient at least, in a round manner. Today one professor would visit, tomorrow some other professor would visit, so that whether the junior doctors or the treating doctors are really taking proper care, giving proper medicine to that patient or not. The fourth thing we did, in Indian context, whenever you get ill or whenever someone gets ill, he anticipates that someone would come to console him, to motivate him that yes, it is a temporary phase and you will come out of this in shortest possible time. But being in isolation, the chances of meeting with relatives and the friends was absolutely not possible. Then we have provided, it is still working, we have provided tabs and smartphones. And if the patient is in good condition in the sense he is not critical and he is not on oxygen or off oxygen, he can be without oxygen for 5 minutes or 10 minutes. That time we used to connect him through video call, to his family members, to his relative. And that is also played a very crucial role in keeping the mental health in good shape. And because of this intervention, the death rate has come down. Otherwise, it was one of the highest in India. Now, it is less than the Indian average or close to the Indian average. But we are not stopping there. We are committed to bring it down further. During first wave itself, we realized that oxygen may be a crucial one. Oxygen demand may go up like anything, and it would be difficult. And we had only the cylinder-based oxygen supply system. Because of this, every after 2 hours, the refilling of the cylinders, the empty cylinders, were required. For that, sending person inside with PPE kit or without PPE kit, bringing cylinders outside, sending it to the refilling center, again bringing back. That used to take the huge manpower intervention or manpower support. So therefore, we decided that instead of relying on the oxygen supply system or the refilling cylinder-based supply system, we should switch to the centralized oxygen supply system. And from the first wave itself, we started developing the storage facilities, laying pipeline, developing storage facilities number 1, laying pipeline number 2, and regulating the oxygen supply number 3. Because if it is cylinder-based, you have to go individually to each and every person. But if it is a pipeline, only one knob would be more than enough for you to check on the supply, depending on the flow of the oxygen and depending on the requirement of the oxygen by the particular patient. So all these things, really put our system in place. But the scarcity, because oxygen quantity was not in abundance, how do we regulate the supply? Then we started imparting training to the ward boys, nurses, saying that the oxygen it is not required to maintain 100% or 98 or 97 level, SpO2 level to 97 or more than 95. Even if you can maintain to 93 to 95, that is more than enough. Number 1. Number 2, it should be on and off, because if I am continuously on oxygen supply, my inner tendency try to rely more on the outside supply. My inner will would not develop that yes, I would survive, or I will start developing my inner system so that my oxygen requirement will go down. So it should be on and off. And number 3, whenever one reaches at 93, we directed them to cut off the oxygen supply for some time, at least 30 minutes or 40 minutes or 1 hour, and check his oxygen level again. So this also helped us to save almost 30% of oxygen. Earlier, we used to I mean, say 100 metric ton per day, then our requirement, though the number of patients have gone up, the requirement has gone up, but even then, we could manage within the 70 to 80 metric ton per day. During second wave, when every state, every city was struggling for oxygen, but Mumbai was not on that list. Only one incident I would like to quote about shifting of 168 patients from 4 or 5 public hospitals to some other facilities. It was not because of the shortage of oxygen, it was because of the technical snag in the supply system. The oxygen manufacturing, some technical snag occurred at the manufacturing plant and resulting into the non-supply of oxygen. Then I got a call around 3 o'clock, 4 o'clock, the oxygen level is going down and it may not be possible for us to put all the patient or required patient on oxygen. Then we decided at 6 p.m. that yes, we should start looking for the facilities where the oxygen is abundance or oxygen is enough, and we should ask them, and we have asked them to keep some bed reserves for accommodating the patients who may be shifted to the respective facilities. And our operation started at 9:30, 10 o'clock in the night, and by 4 o'clock it was over. No one was aware what was happening, but the whole night my entire team was
Now, did this, the peripheral hospital infrastructure basically is also working slowly on that. Haven't that been, is there something that you're doing for it? Because there's a huge issue with that, and if they don't run properly with adequate infrastructure and adequate doctors and healthcare workers, the whole burden comes on the big hospitals.
yeah, tertiary care hospital.
So,
Yeah.
so is there anything, any plan that is there, that has been put in place? I mean, not just fourth wave of pandemic, but any other, for general purposes?
Yeah,
also?
of course. I mean, we have a detailed plan in place, and it is not only on the papers. We have started working on it in the sense in the 6 of peripheral hospitals, because we have primary, secondary, and tertiary. In secondary, we have 16 peripheral hospitals. Out of 16, in 6 peripheral hospitals, we have started the DNB courses, Diplomat of National Board. And that is, I mean, we have recruited staff for that, we have recruited teachers for them, and then now students will start coming in the month of June. And that really, I mean, facilitates strengthening of the hospital, secondary care hospitals. Now, most of the surgeries, minor surgeries I am talking about, are being performed in the 6 peripheral hospitals. This also reduces the load on the tertiary care, that 4 medical colleges and 1 medical college. Of course, dental is not in the surgery business, but the 4 medical colleges started reducing the patient load. The number 2, we have provided them with the enough oxygen, enough ICU beds, and the NICU wherever the pediatric ward is there. Now that also that is also helping us to strengthen the facilities. But I mean, the footfall, suppose if we provide better facilities, the footfall will go up like anything, and that result into the crumbling of the system. Now we have decided to strengthen the primary health care as well. We are opening 200, we have around 200 dispensaries. We have decided to strengthen these 200 dispensaries, so that whatever diagnostic tests are to be conducted, those will be conducted at the primary healthcare system. And this will help us to reduce the load on the secondary and the tertiary, because suppose I am getting ill and I am approaching the tertiary healthcare facility for blood testing or for swab testing or for some other testing, then that it is a killing of time and important resources, so which are meant for the critical patients or moderate patients for that matter. So strengthening of the secondary and primary, unless we strengthen these 2 facilities, definitely load on the tertiary care.
But would you expect that there was a neglect on that part, and this has exposed, the COVID exposed the infrastructure of the peripheral?
Neglect, I won't say it was neglect, but focus was on something else. healthcare, as you are aware that in Mumbai, the 4 medical colleges are already flooded with patients, and most of them are from outside Mumbai, be it from the MMR region or other part of the state or other part of or the outside state as well. 30 to 40% percent patients are coming in from outside. So this was not the neglect, but focus was something else. That I mean, when our hospitals are getting crowded with the outside patient, definitely outside patient won't go to the primary or the secondary. They would come down to tertiary. The second thought is, if you are creating spaces, if you are create space in the tertiary care, space in the sense our local patient will be taken care of at the primary and the secondary, and tertiary beds are easily available. We are anticipating the flow in tertiary from the outside Maharashtra or outside Mumbai would be increased. Why? Because the facilities are easily available, doctors are easily available. That is another fear we have. It is off the record. I'm not supposed to criticize this thing. When the facility is there, everyone is free to walk in, and everyone is, eligible for getting good treatment. But whenever you create space, definitely it would be occupied by someone else. So the burden on tertiary care, though we are focusing more on the primary and secondary, the burden would be there, either of the Mumbaikars or from non-Mumbaikars. So you may not find that yes, it is a walk-in facility for me in the tertiary care. I am critical patient. I am walking in and I am getting bed easily. It may not be the case. So strengthening health system, not in Mumbai but across Mumbai or everywhere. During COVID also, we used to take a case of Dahisar and the Mulund Jumbo. 90% patient used to come from the outside Mumbai, close to 90%. So this was because we have created this facility for treating COVID patient, though the Mumbaikar were not in mind, because the patients are coming, then we should treat them. But if the space is there, and if I get to know that yes, space is there, then definitely the flow of patients would be more. So health across the state or across Indian Union should be focused, and at least primary and secondary care should be developed. Otherwise, even if we are pumping in money, even if we are developing hospitals, all the hospitals will be overcrowded, and we will get back to the same situation. In case of need, we may not able to get the bed for, say, infectious diseases or the COVID pandemic like situation, which may, so it would be difficult for us to accommodate patients, even if we are developing more hospitals. Yeah.
Sir, I have a question. So remember in the start, I think in the middle of the first wave, there was a plan to build another 200 bed in Kasturba Hospital only for the infectious diseases. But sir, I think it has now been put on hold. So suppose in future after 10 or 15 years again, we face another pandemic. So what is the infrastructural implementation or plan do we have to handle such pandemic? Because in this pandemic, no one was ready. And Mumbai being the most populous city, we were really struggling for beds, like as you say. So 10 years down the line, what plan do we have? Like we have to start from this time only to make it like prepare for the future pandemic. So
the Kasturba could not take off because of some technical issues, and definitely, and then after that we started thinking on the lines of makeshift hospitals, for developing makeshift hospitals, and therefore Kasturba, it is not shelved permanently. It would be on board after a few months from now. But developing permanent facility, as I said, it won't serve any purpose for the pandemic situation, because even after spending a day and 2 days for getting beds, we could not generate more than 1,000 beds across Mumbai. So far the public facilities are concerned, because once the beds are occupied, you can't really say that now you go home, we are discharging you, and we are reserving these beds for handling the pandemic situation. So makeshift hospital, that is the only option as of now, as I anticipate. So we should reserve some of the spaces, like we are reserving some places for the gardens or the parks or schools. So we should reserve some of the spaces for developing makeshift hospitals or the temporary hospitals, so that during the pandemic situation, these can be put to use, and these can be used for treating, admitting, treating and curing patients. Otherwise, it would be really difficult. Even if we have Seven Hills, take a case of Seven Hills Hospital. It was vacant. Therefore, we could use that hospital for COVID. Had it been the operational or the functional hospital, it would have been very difficult for us to get more than 200 or 300 beds. So that is the situation. So we have to reserve some of the spaces, or we have to develop some of the facilities on the lines of like exhibition center, on the lines of NESCO. Yes. Now I mean during off time, these facilities can be put to use for commercial activities, and during the need, those can be converted into the makeshift facility, jumbo facilities or makeshift facilities.
Sir, there was a plan of constructing 5,000 bed hospital. So the main purpose of that hospital was, MMRs in all the patients, and the Mulund, Dahisar, and Thane, and Mira Bhayandar, all these areas needs to be covered. So, but that hasn't been. There is no progress on that part. So, as you said, we need something big. So, if I think CM had announced saying that we should need some permanent infrastructure for these kind of situations. So,
Yeah, that was the plan, and it was seriously. I personally of the opinion that yes, I mean that should be developed, but because of some obvious reasons, you are aware, we had to shelve that plan. Now it is a need that yes, either in Mumbai or which is area nearby Mumbai where the space is available. Here in Mumbai, the economics of requisitioning spaces, then putting it to use, is not in our favor. We have to pump in money like anything. Again, that is criticism. Yes, of course, criticism is there, but that is not driving away from the idea, the concept. But somewhere down the line now, after a few years, we have to think on those lines, either develop it in Mumbai or area around Mumbai, so that this can be used during the pandemic situation to accommodate more number of patients. But yes, I mean that is.
still we are considering.
Yeah, because I
from the
personally feel
BMC
that.
part, I think state was there in that.
We had submitted proposal to the state government because though as you rightly said, it is not only for Mumbaikars, it is for the catering to the need of the adjoining Mumbai and adjoining district as well. So everyone should be on board. Government should also have some stake into it. The respective municipal corporation should also contribute something, and then it should be a collective effort or collective project, so that the ownership should not be a problem. One agency would manage it, and other agency would share their patient load with this hospital, with this makeshift hospital. But on our own, it would be really challenging.
So what are the model worked out for the probable fourth wave of COVID, and what are the predictions done?
The prediction recently I read reported, I'm not sure whether it was reported by Indian Express or some other newspaper, but I read that in the month of June the fourth wave would be there, and it would be more troublesome. The death rate may be more, the number of patients may be more. So we started thinking, because we had decided to close down some of the jumbo facilities, but now I mean we are again in that mode. I mean, whether should we continue or otherwise, and we have requested task.
Keep them open, reconsidering.
We are reconsidering the decision, and we have requested task force to advise us on that, because the prediction was by IIT. So we can't really get carried away with these predictions. But yes, in foreign countries, in New Zealand, in Korea, the number of patients are going up like anything. So this is also an alarming bell for us. So we can't really afford to be relaxed and just allow the things to happen.
What are other countries doing, or say US, UK?
UK.
Study on that. I mean, if they are continuing with those.
No, they are not continuing, because I mean UK everything is liberalized. I mean even the mask, now they have again reimposed the mask, and since the cases are again getting more in number, testing also they have done away with the testing. They are not conducting any test that is not required. But we can't afford to go with these liberalized policies because our density population, our the economic status of the population is not up to the mark. So therefore, we have to be more alert, and government intervention or the municipal intervention is badly required, either by the poor or the middle class or the upper middle class for that matter. The rich people may generate some efforts, may generate some resources for getting treatment, but it would be a distant dream for the middle class and the upper middle class people.
Is it a big financial drain to continue?
Of course, it is there, because I mean, unused property, maintaining the property unused and paying rent and paying some essential services or maintaining essential services, that is again a burden on a municipal corporation. But I mean, dismantling and erecting again after a few months, that doesn't make any sense.
So, sir, are we planning to reopen the 4 jumbo centers that has been currently shut?
No, those will be on standby. Even if, I mean, we are not planning to open it, but those will be on standby in case the task force advises. So,
Because we were supposed to shift all the equipments and all.
yeah, that list we have prepared, and we have started shifting as and when, because our 3 hospitals are coming up, would be opened shortly. So not only 3, but we have circulated at least to all the hospitals that these are the equipment, these are the material available with us, these are the medicines available, and instead of procuring, you can I mean, use these medicines or the material or the equipments, and then if the equipment is not on the list, then you can procure those by following proper process.
See, I have one more question. In the budget, there was a provision for this yoga centers, right? Because in the COVID, we have seen many people are suffering from mental illness.
Yeah.
But sir, in peripheral hospitals, if you see, we have the infrastructure, but we don't have psychiatrists. The posts for psychiatrists are vacant like for years. Like, shouldn't we just first fill those posts and then focus on other centers, like creating other centers?
So far as yoga center is concerned, it is not that we are roping in psychiatrists. I mean, what we have decided, if the group of 30 people or 25 people write a mail to us on a dedicated email ID that yes, we are group of 30 and we want to get trained by the expert yoga teacher. Then we have decided to prepare a panel of the yoga teacher by I mean, contacting the various institutions who train yoga teachers. We will take them on panel, and we will depute, depending on the residence, depending on their place of residence, depute some yoga teacher on a honorarium to train the group of 30 people or group of 40 people, depending on the size, and that will help us, and that will help them as well. This is number one. If the number goes up like anything, then we also have decided to open some of the school halls or the gymnasiums or the marriage halls to between 6 to 8 p.m. so that, and we will provide TV and the online facility, and those will be relayed, and the people can get trained by just, I mean, watching the TV, whatever instruction, by following the instructions passed on to them through TV. So that is the second plan. The third one is psychiatrists. As of now, we have developed a few facilities in major hospitals. I mean, we are again not focusing on the secondary for the so far the psychiatrist is concerned. Tertiary care hospital, we have very good facility in KM hospital. Another facility is also coming up in Nayar and Sion. This will also generate more manpower, because it is not that only the medical professionals are required to be a psychiatrist. Some other manpower, and those manpower can be utilized for counseling or interacting with the needy patients. So that is what our plan is. But yes, more psychiatrists are badly required, because everyone is, I mean, living in a vertical, and hardly we get a chance to interact with each other, and thereby, I mean, our mental health, our overall patients going down like anything, because our family structure is also crumbling, in the sense, I mean, all of us are working, kids are alone at home, and then again in the evening after getting to home, everyone is tired and no one is in mood to talk anything. So this interaction within the family and outside family has gone down considerably. So therefore, that also we are trying to propagate among the masses that yes, I mean you should dedicate at least 1 hour or 2 hours to interact, to freely interact. The whatever subject would like to talk on, someone would like to talk on, he can do that. So that if the pressure on mental pressure or the pressure otherwise also, if it is reduced, definitely that will also improve mental health. So these are the interventions which are, and for this not only the government or the semi-government facility would work, even private facilities or the some NGOs will also be like laughing club. The principle is same. Suppose someone is laughing, that means he is shredding all his inhibitions, all his negative thought, and he is trying to enjoy for 1 hour or 2 hours. Even otherwise also, if we walk with a friends, definitely we interact. It is not only walking, it is interaction come walking. And that also reduces our frustration, reduces our tension. And all this, the efforts from all sections of the society are badly required. And that is what we should aim for.
Completing 2 to 3 decades as an administrator, now you're about to retire as well. So you have been in charge of, districts like Nanded. You have also held Mira Bangalore Corporation. Both of them were severely affected during this pandemic. Sir, as an administrator and all the experience that you had, what do you think are the fundamental changes that need to be made in our healthcare system for it to be more effective and, to ensure that if a similar repeat happens sometime later, we are in a far better position to handle? What kind of changes would you?
Yeah, strengthening, as I said, the strengthening of the primary health care, that is badly required. Because why? I mean, now take a case of Mumbai. I mean, we have created IT facility, we have created IT supported dashboard, and we also have deputed few doctors in the war room to interact with the patients. But the footfall, the food service that is required, we have 3,500, close to 3,000 community health volunteers on our payroll. We could utilize them. So because of them, if someone is coming to your home with a stethoscope or with a pulse oximeter or the temperature gun, definitely you would feel relieved. Yes, I mean someone is there to take care of mine, and you try to save number of that community health volunteer. Though that volunteer may not be knowledgeable, may not be a medical professional. So the strengthening of the primary health care is badly required. And that is what now we are trying to do, and this is the first time. Earlier we used to get only 300, 400 crores, and out of that only 200 to 300 crore we used to spend. But this is the first time, because of the constant pressure, because of the constant persuasion and the proper preparation of plan. This time we are getting around 2,600 crores. So that is a very big amount. Now it is challenge is that, I mean, how to utilize that amount. Therefore all our plans are ready. We definitely we can utilize these funds for strengthening of the primary and the secondary. Secondary, we have started DNB courses in secondary. We are, I mean, opening new or upgrading the existing facilities by providing ICU or NICU as the case may be. So the strengthening of the healthcare, and that to public healthcare, because in India the private, of course, private has got a big role to play, but for the lower strata of society or the middle class population, the strengthening of the primary, secondary and tertiary is badly required. Now this we realized, we have realized in the COVID pandemic situation, the dependence on the public hospital was more than the private hospital. Even if someone is getting admitted into private hospital, after few days of spending there, he used to get shifted or transferred to the public hospital. Because we have trained manpower, we have enough medicines available with us, and we have proper system in place that yes, I mean proper care is being taken and there is no need to worry about. So the faith in the public system should be increased, and this will happen by strengthening, by providing more facilities like diagnostic facilities, like some interventions, some palliative cares, some psychiatric treatment. All these things should be there in the primary and the secondary health care, this will happen only after strengthening, and once it is done, definitely it will work during the pandemic situation as well. Now RT-PCR, take a case of RT-PCR, we had only one lab. Now we have 266 test collection centers. So these 200 labs, 200 diagnosis centers would be utilized for collection of swab, collection of samples of the infected persons. Today COVID is there, but tomorrow something else may be there. But something else, even if it is there, you have to have, you are required to collect blood sample or the swab or any other, which is connected with you. So that will help you to act as a facility at the cutting edge level, and strengthening thereafter it is possible. Otherwise, sample is being ferried from Dahisar to Kasturba hospital for getting tested, and we have to wait for days to come, days together. So it is not advisable. So the strengthening of this facility, definitely it will work, and that is what we learned a very good lesson during this pandemic.
Sir, we had started this HMIS system, I think in 2019. So, in this system, we were supposed to have this bed count, number of medicine availability, everything online. And patients can have their documents access through any centers who have access to HMIS. But, sir, it is still limited only in few major hospitals like Rajawadi, KM. So are we also planning to increase, implement this all across the hospital's peripheral, major and also dispensaries?
Of course, yes, because that is the HMIS is planned for the to cover the entire health facilities in Mumbai, and we started with 5 facilities because it is a pilot project, and whatever lacunas are there, whatever gaps are there, those gaps should not be there across Mumbai. Once this is successful, it would be implemented in other hospitals as well. But I have my personal reservation, which is off the record. During the pandemic situation, we developed a dashboard, and as I said, we have very limited access to that. Even our mayor was not having access to that, because whenever you are channelizing patient or regulating patient or diverting patient to the facility, if the multiple sources are there, then the pressure on the hospital management would be much more. That you admit my patient, why are you not admitting my patient? And when the beds are available, your dashboard is showing the beds are available. So we deliberately provide limited access to the limited officials, so that there should not be a burden, because at that time the treatment of patient was of utmost important. It was not the beds are available or not. So the medical operator, the hospital operator's mind should be focused only on the treatment, not on the management of the bed or tackling the persons for admitting or not admitting the patient. So if the access is limited, it will work during the off period. But during the season in the sense, suppose if it is a monsoon season and monsoon related illnesses are more in number, and if everyone is aware about the beds are available, definitely those beds would be occupied, and the person who is really traveling from somewhere or distant places, by the time he reaches hospital, the bed would be occupied. So I personally feel that the access should be limited. It should not be open to public in toto.
So what's your take on this booster dose? And do you think it should be made available to common public, because still there is a restriction here, at least in Maharashtra?
Yeah, vaccination has played a very crucial role in controlling a pandemic situation, especially in third wave. Because in Mumbai, we aggressively vaccinated people, and by decentralizing, by resorting to the flexible policies. So therefore, when the third wave struck us in the month of January, at that time our vaccination status with double dose was 90%. As you are rightly pointed out, that booster dose should be made available to the other sections as well. Yes, we are for that, and our facilities are ready to provide booster dose to the needy people. But we are being governed by the guidelines issued by Government of India. So we can't really violate those guidelines, because vaccine is being supplied by them, and it is a COVID portal. Even if I wish to administer vaccine to a particular person, I'm not able to because I may not get access or my entry won't appear on the vaccine and I won't get any certificate. So it is a portal related portal control activity. So unless Government of India issues guideline, we are not supposed to administer booster dose to other section of the society or other class of the people.
What piece of advice will you give politicians going ahead elections?
Politicians in the sense of with booster dose?
In terms of general, because there will rally, big rally going to happen every time.
No, general, because here in Mumbai, as I said, though the access for decentralized bed allocation was limited, but no one complained because we requested them to talk to the war room and he will provide a bed to your patient referred by you if he is really fit to be admitted or fit to be treated in the hospital. Otherwise, home isolation facility is available. But in vaccination, we get a tremendous support from the politicians, and because reaching out, though I am in public service from the years together, but our access to or our exposure to public is very, very limited. But the exposure of the politicians, like representatives elected or otherwise also, they could drive the masses to the vaccine center. And because of them, because of the active participation of them, Mumbai is in safe zone, you can say, rightly declared by Government of Maharashtra yesterday itself that yes, Mumbai has got very vaccination. The role of politicians, we can't really rule out. Their participation is required, badly required, and they supported the vaccination during the entire period. It was unparalleled and it is unmatched.
So you've seen 3 waves and each was challenging in its own way. In second wave, we saw a lot of fatalities. So I just wanted to, and like in the papers we would read your name and you were in a sense at the forefront of doing all this. So I wanted to know that what for you, I mean seeing all the 3 waves etc. What was the most challenging time for you when you thought that okay maybe whether we will be, because in the second wave we saw the fatality rate was much more, in the third wave it was spreading much more. So what according to you would be the, if you recall any particular day or any particular, was the most challenging when you felt that okay things are going out of control and we don't know whether we'll be able to handle it?
Just to add on.
And which was the most anxious moments for you, so?
The anxious because I mean, suppose we used to get a call from private hospital that my oxygen level is going down, or my oxygen supply is going down, and my patient will die. I still have messages from the private hospitals. That was challenging time, so therefore we advised them because shifting of 168 patient was again challenging because even if one fatality, the entire effort of our team would have, would have down the drain in the sense, I mean the people would have criticized us, I mean why didn't you anticipate the oxygen level and you are now indicating that these are not our fault. So that was a challenging time. But the challenging time, I mean, dealing with the private hospitals with oxygenated bed. So we practically undertook the scrutiny, the audit of oxygen in the private hospitals. What is the oxygen supply system? What is the storage capacity? How many beds? And what is the refilling time? Practically, we have a detailed chart with us, and we advise them not to increase number of oxygenated bed, because you have 10 beds, that 10 beds, the oxygen supply would be enough for 24 hours. If we increase bed 10 to 12 or 10 to 15, definitely your refilling time will be reduced and again you would be in trouble. But some of the hospitals advised against, even though they are advised, but they decided on their own, increase the bedding capacity, and therefore we had to stop them, we had to take them off from our dashboard, and we directed them not to admit a single patient, COVID patient, and whatever patient you are having, you shift to our public facility and we'll treat them. If someone is really willing to get shifted to the private hospital, if the beds are available, then shift him there. So that was a more challenging because someone is calling you at the late in the night and I'm running out of oxygen and my patient will die. So, I mean, no one around and you are the only one. And even if you are calling to war room, what support war room would provide in that case? So shifting of the patient that much, but while shifting also a risk was there. Suppose ICU patient or patient on ventilator, if you try to shift him, he may collapse on the way to other hospital. So that was most challenging time, but I mean we could sail through without any major issues so far as the oxygen supply is concerned.
Was there any time you lost your, मतलब तुम्हारा सब, you felt that the
No,
situation
not
would go out of
because,
control?
I mean, every day was a challenging day. I never, felt that now other things are going out of control and now I should withdraw myself. It was not the case. Yes, sometimes you may be low, someday you may be in good spirit, but otherwise also, even during pandemic situation, we were advised that not to travel down to hospital, not to travel, not to visit the slums and other areas, because if one of us get infected, definitely the entire system would be would collapse or would suffer a setback. In the sense, I mean, no one is there to lead the system. But I'm using word but practically every Saturday, Sunday, whenever chance is there, I used to visit slums, I used to visit hospitals just to have take the first-hand information and what are the gaps, how those gaps can be bridged, how is the tempo of the system, and what needs to be done, and to understand their problem and to come out with the solutions. So all these things were challenging, but I never thought that I should withdraw myself and I should now, give it up. It was never happened.
Sir, on the vaccination part, so Mumbai has almost reached 100% vaccination, and there is a thing that about expired vaccines. So, what is our plan? And because I think more quantity is with private hospital, and they are struggling to, I mean, they have to, I think, dump since it has expired.
What we have advised them that, we will provide our vaccine center. They have to provide vaccine and with the operator, data entry operator, because login ID password is with them, then we are not supposed to use their login ID password. So some of the hospitals came on board and they have started vaccinating. They have started using our facility. Vaccine they are bringing in, the data entry operator they are bringing in, and we are vaccinating them. But some of them are really asking for exchange of the vaccines. Here again, we have requested government of Maharashtra to guide us because state government has advised us not to exchange vaccine, because you are not sure whether these vaccines are really stored or really followed the cold chain or not. So because we have to rely on something, so therefore government of Maharashtra has said that don't go for the exchange, wait for further directions, and we are awaiting directions. This is number one. The expired vaccine quantities, it is not huge quantity, some quantity is there, but of course it is a precious quantity, precious commodity. So we have requested government of India what should be the disposal mechanism, whether these vials should be returned to the manufacturing company or to be disposed of by following the procedure of biomedical waste disposal. So that is what in a day or two we may get some reply on that.
Sir, can I?
Go ahead.
So, whether KMC is, at this point of time is spending around 15% of its budget on health. Do you think that is like a decent enough amount to spend on a city like Mumbai? And whatever infrastructure that you are creating, do you think it is sustainable? Because, every time we kind of then get a sense that the BMC has made a request to the state government asking for it to give it money for all the money that it has spent on COVID. So, we are spending, then we are creating infrastructure which somehow seems to be not sustainable. Like 6 months down the line, the BMC will start feeling, if we are bleeding money here, and then you're also asking for money from the state government. So, is there any kind of long-term strategy that the BMC is identifying on this?
Yeah, two things are there. Suppose if we build the facilities at one go, it is difficult to maintain, it is difficult to be sustainable. Let us admit it very frankly. But if we develop in phased manner, like suppose short-term and long-term plans are there, then the sustainability will be certainly there. But we are also looking for the partnership, in the sense, suppose we have 4 medical colleges. enough staff are there, enough doctors are there, enough departments are there. But if we rope in the private sector and tie up with them for opening a fifth medical college in Mumbai, that option that would also again help us to be ready with the sustainable hospital or sustainable medical college. So far as the expenditure is concerned, yes, I mean we are spending money. Last time it was 12%, this time it is 15% of the total allocation. It is good amount, and the most part of it is we are spending on the primary health care. It is not that we are constructing, we have undertaken civil work, and we are not focusing on the other development like diagnostic facilities or other facilities per se. Of course, the diagnostic facility definitely would be sustainable. The third thing, reimbursement of money, because it is SDRF. SDRF, because if we look at the constitution of SDRF, some part is being given by Government of India and some part is being contributed by state government. And the funds are giving to each and every district. So why should we, I mean, not put our claim? So would have submitted our claim to Government of Maharashtra, saying that, I mean, you are giving money to each and every one. So, and this is some part of it is of Government of India and some part you are contributing. Give us that money so that we can utilize it for strengthening the health system. Otherwise, today we may have money, but tomorrow we may not have. So again,
how much is the claim you have put for? How much is the amount of the claim?
Around 3,000 crores. Yeah, because it is as per the guidelines issued by Government of India. It is not that, I mean, we are claiming money without following any guidelines or without doing any calculation or homework. Yeah, that is what we have claimed, and it is, I made it a point that, I mean, we should submit. Getting or not getting, that is a different ball altogether, but there is no harm in asking for money, and that if it is within the frame. Yeah.
Sir, can you throw some light on what you're calling an endemic stage? Because especially in Mumbai, when we are comparing it to other metro cities, I think this is the first time that the daily number of cases have gone down below 100 and it's constant. But we have always seen that other metro cities, the numbers did drastically go down and then it again increased when the wave started. What is this specific reason that Mumbai is not seeing that? Mumbai has a constant, when even the wave goes down, there's a constant number of cases that keeps coming every day. And we have been saying that this will go on. We don't know when there will be zero case or a single digit case in case of Mumbai. What is the reason behind that in comparison to other metros?
Yeah, because Mumbai's survival is on the migrant population. So migration from across the globe, migration from the other part of India, migration from the other part of the state. Because we are not aware if they are carrying any infection with them or otherwise. So our number would be there, but these numbers are under control. If you look at the other cities, because we also compare Delhi, Mumbai, Bangalore and Chennai. So far as Delhi is concerned, the cases increases by meets and bounds. I mean 5,000, 10,000 per day. Yogesh used to share the daily report with me, and I used to compare. The cases are increasing, but in Mumbai it is a steady growth, except a few exceptions. 3 or 4 days we got 5,000 increase per day during the third wave. In the second wave it was a gradual one. So the outsiders are contributing. This is number one. Our system is strong enough that whenever the cases are increasing or whenever we come across a positive case, the contact tracing, then testing and keeping them under quarantine, that we are enforcing very properly. So therefore further spread can be checked. Unlike other part of India, we never crossed 21,000, but in Delhi might have crossed 75,000.
No, it is around 28,000 max.
Third wave, no,
Third wave, 28,000.
First wave, second wave.
Yeah, it was.
Yeah, I mean it was almost more than double, you can say. The oxygen supply, again every city was struggling for oxygen supply, but in Mumbai we never struggled except few exceptions, except few incidences. So our system is, I mean, we developed the system in such a fashion that it will take care of the positive patient, it will take care of the medicine requirement, it will take care of the oxygen requirement. and this intervention help us to check the spread. Therefore, our cases won't go beyond a particular limit, but won't come down to zero, because we are getting constantly, because our trains are full, our planes are full, if you travel down to airport, if you visit airport just like a bus stops nowadays. I mean, you have to wait for hours together for getting the security check. This is the reality. Now, initially, the only 1 hour was more than enough. Now it is 3 hours. You have to invest 3 hours. If it is a foreign travel, you have to invest 5 hours, because you have to go for rapid RT-PCR. Right, it has been taken up now, but earlier it was there. So 5 hours spending at airport and 2 hours flight. That means in all, unproductive investment of time was very, very high. Yeah, but I mean, system, I personally feel that Mumbai system is good, and of course, scope of for improvement is there, and we are committed to that improvement. So daily we are thinking on those lines, and we are trying to develop it.
One thing about the politics on COVID expenditure. So BJP is, every other day they come up with some allegation saying that यहाँ पे corruption है, वहाँ पे corruption है. So I just wanted your say on that bit. I mean, since start of pandemic until now, it's going on. And
no, I was anticipating these type of allegations, because whenever I used to travel down to the facilities to conduct meeting, I used to tell them, you should document the expenditure properly. Suppose if you are inviting quotations, if you are inviting tenders, in a hurry, we should not get carried away with the patients are more, then I will maintain this record subsequently. That tomorrow never comes. So they have maintained the record. They have, followed the given procedure. Given procedure in the sense, whenever we got the authority to spend money, and whatever guidelines laid down in that authority letter, those have been followed. And now we also have advised our municipal auditor and our field staff that, I mean, you should get each and every account audited. So tomorrow there should not be any problem. So far the allegations are concerned, I would like to I would like to say off the record. Suppose if I float a tender, few days back we floated a tender of procuring monoclonal antibodies, 5,000 vials. The next day I got a letter from one of the, I won't name the political party, I won't name the name of that MLA. We got the letter that unless we get the, because you have already procured 500 vials and you have not used it, you have wasted it, and now you are procuring 5,000 vials for no reason, you are wasting money and you have committed 60 crore fraud. So even before floating, even before spending money, I mean, how could you say that I have committed fraud by spending 60,000 crores? So this type of, now these things would be happening because we are facing elections. Unfortunately, I am in charge of the elections as well. So this is off the record. I don't want to be on the wrong side of this thing, but this is the personal experience. If you take another case, day before yesterday I got a letter from Lokayukta that take a case of that 5,000 bedded hospital. In that also, what was how much money we spent? Or take a case of procurement of the vaccine. We floated expression of interest, 8 companies offered their bids, but we could not finalize. But the propaganda or allegation was you were committed to procure vials from the particular company. Since we complained against it, you stopped, otherwise you would have paid to that company. So, I mean, this really pains us like anything, because we can't expect, I mean, whether we should focus more on the treatment or whether we should focus more on the work or whether we should focus on the taking care of the allegations. So these allegations will start coming in, we will reply, whosoever is at fault, he will face the music, whosoever is correct, he will come out clean. This is as simple as that. So we are not, initially we used to invest more time and more energy. Now we are not investing. I personally am not investing anything. I am just focusing on this thing. If yes, you write this, we will reply it. That is because otherwise, if you just focusing on that, do you get the time to do your duties? No, it is difficult in that case.
So I have two quick questions. Sorry. So firstly, there was a lot of back and forth between the union government and a lot of state governments related to oxygen supply, vaccination. It went right up to the Supreme Court. How did it sort of play out here? What were the challenges for you when it comes to that? Secondly, sorry.
Go ahead.
So this is the third year of the pandemic, and we've seen that a lot of frontline workers have had sort of breakdowns, and they've spoken about the toll it has taken on physically, mentally. How did you unwind in all these 3 years?
The first question, because vaccination, because I mean initially we used to struggle with the quota, because the city having targeted population is 92 lakh, because our target population was 92 lakh for vaccination, and we used to get in 1 lakh, 2 lakh, 3 lakh maximum. That was really testing time for us. So we used to distribute 100 or 200 vials per vaccination center, and demand was very heavy. Then plus the second challenge was of the COVID app. It was not working properly. Even if it works, the getting slot was really challenged, because all of you are aware that there was one provision in the that is what we tried here in Mumbai, and therefore our vaccination rate is good. One provision that if it is a camp mode, there is no need to go for the COVID app for booking your slot. You can walk in and you can get vaccinated. So we used that one, and we rated all our permanent vaccination center as a camp vaccination center. And because of that, we could take care of the online appointment seeker. Walk-in facilities were available, so the local population was easily got the access to the vaccine center, and they could get the vaccine easily. But story doesn't end there. The second thing, since the supply was limited, then and demand was very heavy. So suppose 400 persons are waiting in the queue for getting vaccination, but I have only 100 or 200 vials, then I have to ask them to come some other day. So instead of that, we took a decision that instead of 100 giving 100, let us give 400. If their demand is 400, let us give 400. Let them vaccinated all 400 who are in queue. And if we do this, we may use entire our quota in 2 or 3 days time. Then we can close down for the next 3 days or 4 days our vaccine center. The message was loud and strong that yes, now otherwise the batting was from the other side. They used to count the vaccine in the pipeline, in the sense, suppose it is not that the vaccine is stored at one place and I am distributing every day. I have to give vaccine to the vaccine center. So they have storage facilities, say like storing 100, 200, 300. And if I keep counting on those, it is not the proper assessment of the situation. So therefore, we decided to dry up all our centers, close down for 2 or 3 days. That really played a trick, because it is the international news or national news. Mumbai centers are closed for 3 days. And that really played a trick for us. We used to get more quota, more doses. And our COVID, because everything is linked to COVID, that yes, Mumbai is dry now. We can't really say that the Mumbai has got vaccine and they are not vaccinating people. So that helped us a lot, and therefore we are at number 1 so far as the overall coverage is concerned. The second, what is the second question?
How did you unwind in these 3 years?
In the sense, I mean,
As in, after a long day at work, say for instance, especially when
it is a part of life, and during disaster, because it is a habit now. I mean, I never get retired before 12 or 1 a.m. in the night, and I got up at 5:36 a.m. in the morning. If you, I mean, some of you may get my messages 4 a.m. in the morning or 1 a.m. Late in the night. So it is a part of life, and it is really challenging situation, and you can't afford to sleep or you can't afford to relax. And if the responsibility is there, if the situation is demanding, then this is the time, I mean, we should perform. Otherwise, we have a lean period as well. I mean, you can retire at 6 a.m., 6 p.m. in the night and enjoy with your family. But I mean, situation demands, so we are going ahead with that.
Sir, I have a non-COVID question. Sir, in 2019, there was an incident hospital where a newborn child had died. So that was the first time BMC had declared that they will provide insurance in such incidences, because there are many incidences like rat bite and fire and all. So one of the officers told me that the insurance scheme hasn't been implemented because the COVID, कुछ दिनों के बाद COVID start हो गया. So are we planning to reinitiate this insurance, medical insurance kind of such disaster?
No. No, because I am not of that thing, because if we get into that, otherwise then we may invite tremendous litigation, because every day a patient, because you take a case of ICU. In ICUs, the death rate is very high. Someone may claim that my patient is not being looked after properly, and again then you pay me the insurance. So again our energy would be diverted to non-clinical arena. So I personally feel that the insurance is not, granting compensation is one thing, but providing insurance to the hospitalized patient, I'm not of that opinion, frankly.
Sir, how does it, coronavirus, how is it different when it comes to kids? Because every time whenever we are relaxing restrictions, the schools are the last ones to open, or the restrictions are put higher on the education is suffering. So how is it different, and why it's a different decision always for kids?
Because the Pediatric Task Force communicated or opined that the kids would be more susceptible during second wave. So therefore we started developing the pediatric wards in each and every jumbo hospital. Fortunately, the percentage was less than average. Though our preparation was ready, we hardly use any of the pediatric ward for admitting kids having age below 18 or below 12. I personally feel that their resistance power is very good. When we conducted the sero survey for kids, 51% kids were having antibodies. Those were not vaccinated, those were exposed like anything, because you can ask yourself to be at home, but it is difficult for you to ask the kid to be at home. So even then, the 51% kids have got the antibodies. That itself indicates it is the immune power, it is the inbuilt capacity of the kids to take over on the any viral attack or any of the attack in the system. So that way kids are not very vulnerable, but because of the advice given to us by the medical professionals, we had to create facilities for them, and we had to close down schools for more than a year, you can say. But now, the things would be normal. During third wave also, it was opened that we should close down, or we should put city under lockdown, or put some restrictions. I was the only person who was batting for let the economic activities going on. Our facilities are there, we have enough beds. If we exceed 50% occupancy of the available beds, definitely that time we will come to you to put city under lockdown. Because here the mental health and economic activities, both of things go hand in hand. So if I'm sitting at home and I'm not coming to your office, and I'm not doing anything, I'm just, you are giving instructions online to me, and I'm writing my article or my note on that. So it is not going to help unless you come down to office, unless you interact with people, so you don't feel like, otherwise confining you in 10 by 10 room and only 4 faces are there, and then you start quarreling with them, ye nahi kiya, wo nahi kiya. So this reduces your mental health. So to keep your mental health in proper shape, your economic activities, your daily routine should follow. Otherwise, it would be difficult.
So reporters should come to office.
Of course.
So how prepared is the BMC for the elections, the administrative setup?
Yeah, we are, ready. Even if the elections are due in the month of March itself, but we are prepared for the April or for any other date for that matter. If Election Commission declares tomorrow that yes, you have to conduct election after 35 days or 40 days, our system is ready.
And what is your estimate, when would they roughly declare the elections?
Difficult because of the Supreme Court judgment, and otherwise I was of the opinion that in the month of April the election would be conducted, the actual poll would be conducted. Now,
Is there any word, sir, of the record?
No, I personally feel that it should be conducted, it is required to be conducted before 31st of May. because municipal corporation is, it is not overdue, it is a due for election. So before 31st of May, that is the, I have not read the judgment delivered by the Honorable Supreme Court, but Supreme Court might have mentioned that it should be completed before 31st of May.
Is the government very keen that without the
Now the ball is in the court of election commission, state election commission. Government has no role to play of any sort, unless otherwise they come out with some ordinance or something like that. In that case, it would be different ball game altogether. Otherwise, if it is situation as of now, as on date, definitely the election are required to be conducted in the month of April, maximum May.
So if it misses the May deadline, then we won't be able to hold it during monsoon, and then it.
Yeah, again in Mumbai, monsoon may be a challenging one. So 31st of May is the deadline for us. So otherwise,
Or October. Sir, I have one query. I mean, for a lot of us, the face of BMC's fight against COVID has been Mr. Suresh Kakani. I mean, in all newspapers, COVID ke related.
because I'm interacting daily with their because I mean you have to have someone officer, some officer that yes I have spoke to that person, that officer, and then it is bound to be there.
But sir, you also have charge of the western suburbs, and I mean, whatever your career that I have seen, so you have had a stint in urban development union department as well, and the World Bank. Sir, there is always a lot of discussion that happens within the reporters or like basic analysts who kind of say that the BMC has become too big and too unwieldy to run the Mumbai city efficiently. Now, because you are in charge of western suburbs, I mean, what is your perspective on the way BMC is at this moment? Do you think running a smaller corporation makes it more effective?
No, because I mean the strength of Mumbai BMC, because I am fan of BMC, because I mean though I never worked in BMC, this is the only third year of mine, just completed 2 years now. But I mean dividing, two aspects are there, dividing BMC into 2 or 3 parts, I would be not in that favor. Then managing smaller corporation, I managed the Mira Bhayandar Municipal Corporation. There also, I mean, I could implement some of my ideas, not all. But from that place, I got transferred to some other place after 1.5 years. So I could not implement in toto all my concept. But here in BMC, I got a tremendous freedom, I got a liberty, I got a time, the system is there. Though allocations are there, but I mean, of course, this is to be taken as a routine of your, since you are in public service, that is bound to happen. But the strength of BMC is in the united body. It is not that if we divide it further, it would be difficult to manage. It would be more callous or more it will create more confusion, and coordination would be much more difficult, because your sewer lines, your water supply lines, your electricity supply, all your systems would be, how would you, I mean, suppose your pipeline in Mulund get burst and your South Mumbai is getting suffer. The Mulund Mulund in charge won't bother for repairing of that pipeline. But the South Mumbai is suffering, and again you have to be dependent on that this thing. So integrated body is required to manage the city like Mumbai.
Sir, yesterday the High Court said that to the state government and BMC and other corporations that they should not curtail the fundamental rights of citizens by not allowing unvaccinated or singly vaccinated people in local trains. Why BMC is averse to this, despite the central government has okayed and they have said that no, there is no objection.
I mean, there are two things are there. Suppose, I mean,
and is BMC willing to allow it in future?
I'm coming to that. I mean, it is allowing not allowing the unvaccinated people. This is number one. The decision number two. The process of the High Court has said that, I have not read the judgment, but I have read the news item on that. High Court has said that the process of reaching out to decision has not been, that they focus on the process. If you ask me, suppose I am traveling in a local train, I am unvaccinated, with mask or without mask, you are vaccinated, But in a crowded compartment, if I am carrying some infection and you may get infected, so it is not my right that I should not put mask on, I should not go for vaccine. Here the public right is more important than the private right, personal right. So public right, if it is there, you can't really say that my private right is getting breached. Because of your private right, if the public is suffering, then definitely the more weightage should be given to public, not to the private.
The High Court in its order has expected from the agency that since the situation has been restored according to High Court as per pre-pandemic days, that particular restriction, the restrictions can be eased now.
No, because I mean,
It's an expectation.
yeah, of course, expectation, because now we have opened all the facilities. Because I mean, no sector is there which is under the regulation, except 1,000 person in a social or the cultural or gathering. Other than that, restaurants 100%, all other activities 100%, offices 100%. So, what regulations are there? Only vaccine plus mask. So people are also batting against the mask or against the vaccine. Of course, there may be some reasons for this, but we can't really. We should focus. We are focusing more on the larger public interest instead of focusing the individual interest. So therefore, as of now, my personal opinion that even if the COVID situation is getting over, we should use mask, because you never know, the other person may be infected. I would quote one example. We have asked the people to wash their hands at the repeatedly or at regular interval. Because of this intervention, you won't believe, our hepatitis A and E cases, our gastroenteritis cases have gone down by 60 to 80%. But it is unnoticed. I am washing my hands before eating. I have shaken your hand with you, and after that I use the sanitizer. So whatever infection is there, whatever the cross infection is there, I could wipe that out by using sanitizer, by using soap, or by using water. Because of that, my hepatitis A and E cases, my gastroenteritis cases have gone down considerably to 60 to 80%. Last, as compared to 2019, it was 83% reduction. So far, the hepatitis A and E is concerned, 67% reduction in gastroenteritis cases.
Can you provide
Yeah. So I have shared. I must have shared with Rupsa or with you as well. But I will share that data with you. So single intervention is preventing me from the deadly disease, hepatitis A and E, gastro. Of course, if I'm drained out, definitely it would be difficult for me to come out of that. A single intervention, if it is preventing, we should go by that. Same is the case with mask. You never know who is infected. I am infected or he is infected. But suppose if it is a cross infection and we are coming into contact with so many people at a time, so that population may get infected. So it is always advisable to use mask. It is always advisable to go with the vaccination. Mumbai is saved because of the vaccination, and there's two things, mask and vaccination. Otherwise, what is the difference between Delhi and Mumbai? Delhi also has got the migratory population, Mumbai also has got population. But here 95% patient doesn't require admission, hospital admission. They are getting cured in 3 or 4 days maximum. On the contrary, during second wave, the other part of the city used to, the demand of oxygen, spiral like anything. So these basic things are required to be followed, and I personally feel that it should be there in the system.
Non-COVID question. Since you are in charge of Western suburbs, the High Court has recently, in terms of Malwani incident, has passed some strictures against BMC about the rampant corruptions in construction of illegal structures and how the BMC should take an action.
No, it was for Bhiwandi.
Yeah, no, it was also about Malwani incident in which Justice Devdar committee was appointed. So they have.
Yeah, because they have directed, because it is again the coordination between the different agencies. You take a case of Malwani. Malwani land is the government land. It is a collector land. Collector has got a different set of system like deputy collector.
The High Court in its order has clearly said that BMC, being the planning authority, is now competent to take action irrespective of whether the slum belongs to the state land. So how, in looking forward, how do you think that the actions can be taken against such illegal construction so that the deaths can be?
Yeah. suppose now, I mean, suppose if it is my property, if it is a government property, if it is a municipal property, or it is a private property, 3-4 categories are there. Government has issued direction that the property owner means the government, and government has a system that yes, additional criteria encroachment is there, additional criteria encroachment removal is there, then a deputy collector there are down the line, and they are required to take, they have so far the Malwani is concerned, the strips have been allocated by government, by the collector, for construction of the small houses or the big houses, whatever. As per the guidelines given to us by the government of Maharashtra, that this is the responsibility of the collector. And we have shared our this thing in the Malwani's case. This case is clubbed with the Bhiwandi case, and in that Bhiwandi case, the Malwani reference might have been appeared. But in Malwani case, court also opined that yes, it is a government property and the care should be taken by the government, since government has got the system in place for taking care of the removal of the encroachment. Of course, if these guidelines are amended by government, definitely we will follow those guidelines. It goes without saying.
Last question for me. I mean, how do VMC can make its app more convenient and friendly? Because last month a few people who I know live in slum have come to me and wanted to address their complaint on BMC app, but BMC never took cognizance of them. So how BMC can be more responsive, and at least they can call back and get the work done easily.
Yeah, I mean now, I mean our war rooms, I mean we are trying to utilize this war room. Now the COVID has gone down considerably. We are not getting any calls so far as the COVID is concerned. So such complaints can be shared with the war rooms. Those will step in, because of the complaints are 5 type of complaint, because I am not getting water, my garbage has not been lifted, my road is in bad shape, my health is in not good condition and I am not getting any support, and any other related, water supply at the most, water, cleaning, health, fumigation is one more, fumigation, because PCO staff is engaged in fumigation. So this type of 5 complaint we have assigned a different officer in the war room itself to take care of such complaint, because usually such type of complaints are to be used to be addressed by the local representatives, elected representatives, because that is their you can say the intervention and expand the chance of expanding their base or increase their popularity. But now, because from 8th onwards our municipal commissioner would be administrator, then the responsibility will be more on us. So we have already thought of this thing, and we have directed them to share their complaints about these 5 issues with the local war room, so that those can be addressed properly.
So one last question which I had was, that was those fires, and in many cases it's not working. So what kind of mechanism do you, and Mumbai is going to grow only vertically now. So what kind of system do you suggest, that there's a permanent solution to this?
A permanent solution, because my personal involvement, I am occupant of the city, I am office bearer of that society. The personal requirement, personal intervention, or the personal attention should be there. That because my life is at risk. So whether my system is working properly or not, I am paying the maintenance charges. The society should also step in. If they wish, they can increase the maintenance charges, and they can, I mean, check the system, whether the system is working properly. This is number 1. Number 2, the empanelment of the fire auditors can be another thing, so that instead of waiting for the fire auditor to come and to inspect your building, the fire auditor can be hired and he can check. Of course, he should be empaneled. Number 2. Number 3, we have started imparting training to the occupants of the building, because they are the first responder. Because even if the fire brigade reporting time is 5 minutes to 7 minutes or sometimes 10 minutes, but as a first responder, the neighbor or the family member is the first responder. If we impart some training to them, definitely some reduction in the property loss and the human loss would be reduced. Just take one example. whenever the fire occurred before my joining to Kamla Mill, that time the educated population was gathered there for celebration of the birthday because it is a high-end user property. The educated girl locked themselves inside the bathroom, and because of that they lost their life. Now suppose had they been trained by the in our center or wherever possible, or had they read the books, it is a basic thing, because if the smoke flows away, we should walk down, we should kneel down and we should walk down, or we should not get ourselves locked, or we should use the wet napkin. These 3 to 4 basic things, had they undertaken, definitely their lives would have been saved. Some of the lives would have been saved. That means though they were educated, but they were not equipped with the knowledge how to take care of the personal safety. So therefore we have started, realizing this, we have started the training for such persons from the building, that in case of some emergency, what should you do and what should you avoid. So that training is already ongoing in our training center, and definitely that will bring in more awareness among the masses, and they would be able to save their life.
Can I just ask something on the same thing? Sir, now like sir was saying, the buildings will be vertical. So the recent case of Sardev, they died of smoke, and these people were used to live in chawl. So maintenance will always be an issue because they don't have that much money. So you think now not only this building, even SRA buildings, they are very tall. So you think something can be done at the infrastructure level itself, because the entire smoke got accumulated to the last 3 floors and they died of smoke. So do you think some innovation could be there, some infrastructure change at the construction level itself?
Whatever innovations are there, unless my personal involvement is not there, so this thing will keep happening. My personal involvement is there because you are the occupant, you have to maintain the system. We can provide one-time solution, but to operate that solution, to go with that solution, of course the occupants are should invest more time and more energy on that, because unless it is, suppose take a case of use of helmet. Initially the helmet use was criticized like anything, that government is trying to promote or trying to support the helmet manufacturer. That was the criticism, or that was the allegations made against the government. Now everyone is wearing helmet, because we have realized that use of helmet, definitely it won't affect, even if I met with an accident, it won't affect my life. At the most I may get fracture, I may get some injury here and there, that is curable. Otherwise without helmet, the chances of losing life is very, very high. So this is just same thing. If with your wet hand you never touch the electricity button, you get your hand dry before touching it. So all these things should be a part of our life. It should be a part and parcel of our life, our daily routine. So if once a month or twice a month or thrice a month, we can have a mock drill, we can test the system. So that type of new normal should be there, otherwise it would be very difficult.
Yeah. Okay.
So the same thing, like for example, in
Yeah.
BMC hospitals, like I just said, in 2019 a newborn child died in an ICU because of a fire in KM hospital. And then later it was found out that the ICU machine, the ventilator machine, was donated by some organization, and there was no proper checking. And there was some also problem with the wiring of KM hospital, because it's a very old hospital. The wiring hasn't been audited or scrutinized properly. So in a hospital basis, what can we do to improve the fire safety?
Frequent check of the frequent fire audit, number one, and then whether the equipment are really requiring replacement or really requiring some maintenance, that is number two. नहीं वही ना, तो वही मैं वही बोल रहा हूँ कि भाई मुझे किसी ने दिया, फ्री में दिया है, तो फिर मैंने उसको मेंटेन करना चाहिए. So that should be on my board. Once, otherwise I should not accept. That is what we have directed our medical fraternity, that you should not accept donations. If you wish to accept, then you should list out, 3 to 4 formalities are there. Then those formalities should be completed. Without that, we should not go ahead with that. Otherwise, we accept the machine costing 2 lakh rupees, and I happily accept that, yes, it is a donation, I should accept. But the consumable is 8 lakh rupees of a year, and I have to procure that consumable from the same manufacturer. So I end up losing on that. So we put restrictions on accepting donations from the private parties or from the NGOs, unless otherwise, I mean, it is really very expensive machine. The cost of consumables is up to the mark or within the limit, then we can go ahead with that. But otherwise, I mean, we should manage, when we are accepting machine, we should manage the machine, we should operate the machine, we should manage the machine.
So thanks, sir, for coming and answering most of our questions.